Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institute, and today we are going to do a writing session, which would be one of the best writing sessions you would have ever gone through. If you are watching this video or any video on OET for the first time, then this video would be the master class for you to understand each and everything about writing. Even if you are at the advanced level, I promise you this class is something that's going to benefit you. Please subscribe our channel if you have not. And for the best OET coaching, you can contact us on +91 76 967 34256. Thank you. And today we are going to cover this writing session. So I'm taking directly to the point. Yeah. So here it is. So let's discuss the OET writing. And this is Dr. Bhupesh from Dr. BKM Institutes. Again, I hope you all know us. And for the students who are having first class of mine, please always watch our videos till the end because it's gonna change your life when it comes to OET. See, first of all, you need to understand OET writing. Again, I'm telling you, this is very easy. And the most common question asked by all students, sir, what is a discharge letter? What is a visit letter? What is discharge back letter? What is referred back letter? What is a referral letter? So these are the common questions you have in your mind. So today I'm going to discuss them all. First of all, please understand when you are nurses and doctors, that is why you have joined OET and you think that OET is easier. Then you are absolutely right. OET is not the easier, it is the easiest test. You just have to behave like nurses and doctors. That's it. Means discharge letter. Sir, what is a discharge letter? Buddy, when patient gets admitted to the hospital, then he is discharged. So we write a letter to the concerned person who would be providing the follow-up care. So that is a discharge letter. Suppose the patient is getting discharged and community health nurse will provide the follow-up care. So it is a discharge letter that we are basically patient was admitted in our hospital due to fracture, due to heart attack, due to some serious ailment. He was admitted. Now he is getting discharged. So you are writing to the nurse to provide the follow-up care. So what will you write? You will generally say, like, if the patient is of heart attack, please take care of his vitals all the time. Please provide him medications on the time. If you are writing in the fracture case, you will say, please take care of the plaster cast. Plaster cast will be removed after 2 weeks. So please bring the patient to the clinic. So these are the things. That is how simple this follow-up care is. And in OET, everything is given to you, everything. So you have to write 180 to 200 words. And by chance, again, if you write 210 words, that is not an issue. 220 words is also not an issue. So you don't have to worry about anything. Second kind of a letter is a visit letter. Sir, what is a visit letter? Come on, yaar, you are nurses again, you are doctors. What's the problem? Visit means now you are not in a hospital. You are a nurse at a clinic. Patient came to you a month back. Then he again visited you after 15 days. Today again he has visited for the third time. So it is a visit letter. That means patient is visiting you. Most of the time visit letters. So if I talk about discharge letter, they are follow-up care letter majorly. If I talk about visit letter means that the patient might not have improved. Suppose if the patient was coming to my clinic, I gave him the medication and I told him to come back after 1 week. And after 1 week, patient says, oh, doctor, I did not get better. Oh, nurse, I did not get better. Then you say, okay, take a stronger medication, do some exercises, also take a good diet, you will be better. Then again, patient comes today and patient says, oh, nurse, oh, doctor, I'm not feeling good. Then what will you do? You will send him to the senior surgeon or senior specialist, or you will send him to the specialist, to a senior doctor, which is who is a specialist. You will say, doctor, my patient is not getting better, and now he requires your expertise. So these are the visit letters where you are most of the time referring the patient to the experts. For doctors, this is the most common letter. And I got many messages the last time. As you can see my video, the last time I told that discharge back letter or referred back letter has the maximum chance to come, and the last time the same letter came. Now this time it can be on the cards. So please prepare your visit letter in a very nice way. Today, who are the students of Dr. BKM Institute, they have been given homework of visit letter. So the people who have exam this time, visit letter can be one of the letters you can look forward to. Again, visit letters are the easiest letters. We will discuss about those in detail. Now talking about the discharge back letter. Sir, what is a discharge back letter? Discharge back letter means a GP referred the patient to the hospital. Sorry, patient came from a residential home. Suppose if patient lives in a residential home. If patient lives in a residential home, he was sent to the hospital because in the residential home, he had fracture, he fell down, or maybe he had a heart attack, he had migraine. So patient was sent to hospital because he was not comfortable in the residential home. Or you can say retirement home. Means the patient lives in a particular home, you can say nursing home, retirement home. So patient lives there. He came to us, he was referred to us, so he was admitted in our hospital. Now we are discharging the patient because he is better. So patient came to us, he is better. So we are discharging the patient back to the nursing home. So patient is going back to where he lives. We are discharging the patient back to retirement home. So this is simple. If the patient is going back to the residential home, means he came from a certain place, he again is going to the same place. I hope it is okay for all of you now. It's very simple again. This can be little tricky, but it's not tricky. Suppose if we talk about our country, people live in retirement home. Suppose after 70, because it's not common in India, that is why we do not understand this concept. In foreign countries, what happen? Normally, when patient is around 65 or 70, he goes to a retirement home, so he lives there. But whenever he will face a problem, he will come to the hospital. Hospital will provide the treatment. He will become better. So after getting better, where would he go? He would go back to the retirement home. So he came from the retirement home. He is discharged back to the retirement home. Simple. Simple. Now referred back letter. So referred back letter, discharge back letter, it's almost the same. Yes, it is the same. Discharge back means place matters, place. Because he came from a retirement home, going back to retirement home. Referred back letter means GP send the patient to hospital. So GP sent the patient to hospital. Yeah. And we are the nurse or doctor at hospital. We provided the treatment. Patient is better. So it is same as discharge back letter. But in discharge back letter, it was a place. Now it is GP, a person. So GP sent the patient to hospital. After getting better in the hospital, he gets better. So he is being discharged. And we tell the GP again. We refer the patient to same GP again. Same GP again that now you provide the follow-up care. So I will tell you a case. Suppose if a patient has a chest pain. He goes to a GP and GP says it can be heart attack. So GP immediately refers the patient to hospital. Now in the hospital, he stayed for 2 days or 3 days. We place the stent. We now the patient is better. Heart attack has been cured. Now he has stents. We are discharged, or maybe we have done the bypass surgery. Now patient is better. So we are sending the patient back to GP for the follow-up care. So GP now will take care of the patient. Why is it happening? Now you will say why GP is providing the follow-up care. Because guys, in hospitals in the foreign countries are very busy. Very busy. That is why they will not provide the follow-up care once even in India. If you have if somebody has a heart attack, that patient is discharged after 2-3 days, and then he goes back for normal visits in the OPD for the follow-up care. So in foreign countries, he goes to GP. He does not go to hospital because hospitals are very busy. And the last letter you say is referral letter. See guys, in a visit letter, if you can understand, you are referring the patient to a specialist. It is a referral letter. In the discharge letter, you are referring the patient to a nurse for the follow-up care. It is also a referral letter. So don't get confused about this letter. Simple. So there are four major kinds of letter in OET: discharge, visit, discharge back, and refer back. Now, how to write all these letters? I will tell you the first main, uh, discharge letter, and then you will understand everything. It will become very, very easy for you. I promise you. Just concentration, please. Concentration of uh, around 15 minutes. You will understand everything about OET. Discharge letter. Discharge letter, again, I told you that patient was admitted. We are discharging the patient and we are writing the letter to a nurse to provide the follow-up. So this letter is being written regarding Mr. X, Mr. X, M capital. The first name of the patient should be capital. This letter is being written regarding Mr. X, who was admitted to our hospital due to whatever the reason is, due to acute myocardial infarction or due to viral infection, whatever the reason is, due to viral infection, or you can say due to jaundice, or you can say due to dengue, whatever the reason is. Sorry, these are not question marks. Yeah. So means you just tell the reason. So what happens to patient after getting the treatment? After getting the treatment, so the first line is this letter is being written regarding who was admitted to our hospital due to this thing. After treatment, so what do you do in the hospital? You provide the treatment. After treatment, he is better. So he is being discharged. That's simple. Patient came to us due to this reason. After treatment, he is better, so he is being discharged. Now he requires follow-up care, for which, nice connector, for which he is being referred to you. So this is another way of writing, because in OET letters, if you are an old student of OET, there are so many times when we use therefore. So you can prevent the word therefore by using this connector. That's so he requires, S. He requires, very important S, very important for marks. Now he requires follow-up care, for which he is being referred to you. So now you are telling to the community health nurse that he needs follow-up care. Or maybe you are writing to the social worker, you are writing to the district nurse. So this is a discharge, simple discharge letter. Then the second paragraph, you write social history and medical history. Relevant. Whatever the nurse needs. Third paragraph, you write during hospitalization. Now you want to tell in the discharge letter that what happened in the hospital. So obviously this during hospitalization will majorly come in the past. That is the key. So for the past, how to make lines? Now I'm telling you the lines as well. During hospitalization, the patient was administered IV drips. So the key grammar in this is, if you will realize, was were third form. Was plus third form means was administered by us. So the patient was administered IV drips and he was advised to take rest. Further, he was educated. I'm just telling you the simple lines, how simple the grammar is. He is educated regarding this and this thing. He was also encouraged to do this and this thing. Dressings were applied and the plaster cast was applied. Whatever, what I'm telling you, I'm just telling you random grammar. Was plus third form, was plus third form. Further, was plus third form. He was also encouraged. Never start a sentence with also. Was plus third form. That's it. If you say in addition, antibiotics were also given. But again, grammar remains the same. antibiotics were also given. If started word is there, then you can say was also commenced. Commenced is the word for starting the medications. Now this is simple, that's it. Third paragraph all over. First paragraph simple. Second paragraph social history or medical history. Present tense 90%. But again, if I will write this, it will become complicated. But generally saying he is a smoker and drinks alcohol, something like that. He is a known case of diabetes and all that stuff. Whatever you want to put it here, and hypertension. So you can put the tenses over here. That's it. Almost three paragraphs are over. Last paragraph, discharge letter. Now this is a pattern. Like the first paragraph is a pattern. Second paragraph depends upon present or past. Third paragraph, most of the times past was were third form. And the last paragraph. This is how you start the last paragraph. It would be highly appreciated if you could. So please understand, don't don't mug it up. Don't mug it up, because if you will mug it up, you will never be able to make it easy. If you want to make it easy, please understand. You are writing to a social history or social worker, community nurse, district nurse. So you are writing this letter, discharge letter, last paragraph to that nurse. You are saying it would be highly appreciated, nurse, if you could provide regular medications to the patient. So please understand, it is not cramming. That is normally in when you will become a nurse, you will anyhow write this way. It would be highly appreciated if you could do this thing. Then you will say, kindly advise the patient to take rest. Simple. Then maybe again you can write the same line, kindly do this, kindly do, but you want to take the marks of grammar. That is why you do these alterations. So first line you always start this way. Second line you will say, kindly advise the patient to take rest. Then passive voice. Now you want to take marks of grammar. The now you are telling the nurse that you should educate the patient. So how do you say it in the passive voice? The patient should be educated. So that's the grammar. Should be plus third form. The patient needs to be educated regarding diabetic diet and medications. So this is the grammar. And last, he also needs to be advised to take whatever. What I am teaching you is grammar. So marks are for this. It would be greatly appreciated if you could. The patient should be educated. He also needs to be advised. Simple sentence of kindly. If there is fifth line, you can also say it is important to assess the patient for this and this thing. That's it. That's your discharge letter. And overall minutes I have taken to write this is 90. It's sorry, 10 to 12 minutes. Word count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. 15 on an average. 30, 45, 60. I'm just counting the lines. Okay, I will count the line. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. If I do 13 into 15 or 12 into 15, it should be 15 into 12, 12, 5 is 60, 180 words. So this is how small OET letter is. That is why I say OET writing can be done in just 10 minutes. If you know the concept. First of all, imagine to whom you are writing the letter. It is a discharge letter. That means patient was admitted to your hospital. You are discharging the patient and you are telling the nurse or a social worker to provide the follow-up care. So will we say, It would be greatly appreciated if you could do this. Kindly do this thing. The patient should be educated for this thing. He further needs to be encouraged for this thing. How simple. Don't make it complicated. And in the first paragraph, after treatment, he is better, so he's being discharged. Now he requires follow-up care for which he is being referred to you. So please understand what is the main line of purpose? This. What is the main paragraph of purpose? This. So these two hold the maximum marks. That is where you should take care. In this paragraph, don't do grammar mistake, even if by chance you miss one line or you write extra one line. Even in this paragraph, if your grammar is good, you miss one line or you write an extra line, it's okay. Nothing to worry. You will still get 350. I'm talking about B. I'm not talking about C plus. This is how simple OET writing is. Please do not make letters complicated. OET is the easiest test of the world. Please let it be. Don't make it complicated. Nothing. Now take a pause. Rewrite the same letter. Copy paste it. Now you guys have problem. Oh sir, if I would copy, how would I learn? My dear medical professionals, we have learnt everything by copying someone. When we wanted to learn how to dress the wound, we copied our seniors. When we wanted to learn how to help in the operation theater, we copied our seniors. When we wanted to learn how to give medication to the patient or how to handle the patient, we copied our seniors. Please learn to copy, then improvise. Improvise means then whatever you can do better in that. If you cannot do anything better, copy it. You will pass. Don't create a scene. Why should we copy? Guys, only the scientists are the people of the world who do not copy. Rest everybody in this world copies to their seniors. There is no problem in copying anybody. Write exactly the same pattern, improvise a little according to the letter. That's it. So I will not cover all the letters over here. Anyhow, referred letter and discharge back letter has come, but I cannot guarantee that will not come in the next exam. It can happen, but we will cover that letter before that exam. That means the next exam is on 10th of February. So we will cover the letter on 8th of February, discharge back and referred back. For now, these two letters we are covering. So please copy paste today and now only to become the most professional candidates for OET. Please. Now coming to a visit letter. Again, let's discharge letter. You have understood the concept. The patient was in our hospital. We are discharging the patient. So we are writing to the nurse that please provide him follow-up care. Now coming to visit letter. Again, it will take 10 minutes only. I will write in front of you. It will not take more than. The time in my clock says 30 minutes and 19 seconds. After 41 minutes, I will let you know that my time is up. First paragraph, do not write anything complicated. Please understand. Patient came to us for one visit. Patient came to us for second visit. Patient might came to us 7 visits. Not a problem. 7 visits, 10 visits does not make a difference. Understand today visit because today visit is the main reason why we are referring the patient. So just in the first instance, know to whom you are writing the letter. If you are writing to an eye surgeon, then find the problem of the eye in the today visit. If you are writing to a cardiologist, find the problem of the heart rhythm or pulses in the today visit. If you are writing to a surgeon, find the reason why you are writing the letter to surgeon. Find the reason from the today visit. So how do you write it? Grammar. Again, I have told you each and everything, including grammar connectors. Everything has been covered. Don't have to worry. Just write this simple. In addition, Further, write only these things. That's it. Don't make it complicated. Now this letter. Let's see. This letter is being written. That's the grammar again. Same regarding Mr. X. So let's imagine she is a girl, Mrs. Y. If by chance you don't know whether it is Miss or Mrs., you simply write MS. Simple. This letter is being written there. Who has been suspected with, if question mark is given. If question mark is not given, who has been diagnosed with. If diagnosis is given. If assessment word is given, then you will say who has been assessed with. Make it simple again. Who has been assessed with. So this letter is being written regarding Mrs. Y, who has been. Now, what is the difference in the grammar? Now you will understand the grammar as well. When it was past, was plus third form. That is the only grammar you should know. When it is present, has been third form. That's the only grammar you should know. Passive voice. Who was suspected by us, past. Who has been suspected by us, today. Has been third form. Just this much grammar of OET. So this letter is being written regarding this person who has been assessed with this problem. Therefore, he is being referred under your expertise on urgent basis. First paragraph, almost in every letter. Again, you have to improvise a little depending. Suppose the patient was diagnosed with heart attack or acute myocardial infarction. Therefore, now you are writing this letter to a cardiologist. Suppose the patient has been diagnosed with fracture. So obviously you are writing the letter to orthopedics. Suppose if you are saying patient is diagnosed with inability to see anything, obviously you are writing to a ophthalmologist. If you are saying diagnosed with ectopic pregnancy, so you are writing to, yes, obstetrician or gynae. That is how simple. First of all, understand to whom you are writing the letter. Then you find the main problem. So this is the purpose. In follow-up care kind of letter, this was the purpose. In this kind of letter, this is the purpose. That's it. That's it. Now again, simple. Social history and medical history, which is required. Second paragraph. Third paragraph, just like in the discharge letter, hospitalization was there. In this letter, visits are there. On first visit, now the same grammar. The patient complained of. Sorry, on first visit, the patient complained of. Now you will say, over here, sir, you were saying was were third form. Over here, you are saying only second form. There is no was. That is the last thing you need to learn about grammar. Patient complained of means patient complained actively by himself. And this was IV drips were given by us. He was advised by us. He was educated. So it was a passive voice done by us. Whereas active, there is no use of was. So you can say patient complained of. You can say patient visited with chief complaints of. You can also say patient presented with whatever symptoms. So the first line, on first visit, the patient complained of this thing. Second line, along with that, if there are more symptoms, then along with that, he was also having this thing. Now, symptoms are the only thing that are in the active voice, first line. Rest all passive. On examination, On examination means examination is done by us. On examination, he was found with. Now the same grammar will come. He was found with this. Now we'll say symptoms, then you are saying signs. Signs are done by us. For example, he presented with fever. The sign of fever is on examination, he was found with elevated temperature. Suppose he came with pain. Then most of the signs, most of the time, sign of the pain is tenderness. So that means on examination, he was found with this symptom signs. Then what will happen? Therefore, he was diagnosed with this. So means in the visit letter, you will say symptoms were this, signs were this, therefore he was suspected with, or he was. So now you, if question mark is given, then you will suspected with. Now again, the same grammar has come. Was were third form, was were third form. And only in the first paragraph, you will say has been, because you are telling about today. In the past, again. If you have to write more visits, then again, copy paste. Then you will say on second visit. That is how simple it is. On second visit, you if you have used complained of, then you can use on second visit, patient presented again with similar symptoms like fever, this and this. On examination, he was found with this. You can change this word. He was assessed with. So just change the word, rest all the same. If you want to change this thing, if you are tired, therefore he was suspected with, so you can say on the basis of signs and symptoms. That is the only change. So rest, all the grammar will remain the same. Just copy paste this. Copy paste this. On first visit this, second visit patient presented again. Examination, he was found with this. On the basis of signs and symptom, he was suspected with this. Now the final today. Again, the letter is all over. Today, the patient has visited again. So now you are making it present, has plus third form. Patient has visited again with symptoms. He has been found with signs. So the only grammar change is was were third form, which was in the past, now again becomes has been. That is the only grammar. Now we are talking about the last paragraph. Like in this also, first paragraph was purpose and last paragraph was purpose. In the same way, this paragraph was purpose and the last paragraph was detailed purpose. He has been found with this. Therefore, he has been suspected with this. Now this is the only word that will repeat from here. Suspected with ectopic pregnancy. So I'm putting it here. So this is the only line that would be same. Therefore, he has been suspected with this. And then you end up for which your expertise is highly required. And that's it about OET, letter writing. And this is the letter that is, I think, should come this time. Visit letter. Simple. Please copy paste. I know I have done little faster, but that is the time you will take. Total 9 minutes, 40 minutes, 30 seconds. So total, I have taken 9 minutes to complete this letter. That is how easy OET writing is. First paragraph purpose, social history, medical history, visit letter in the past, was were third form. If the patient is complaining himself active, complained of, then this is again has been found. Passive voices present in today visit has been, rest all was were third form. Simple. Please try to learn this grammar. Again, I will write it for you. This is the main thing. Again, I told you to see the video till end. Past, second form, active, was were third form, passive. That's the only grammar. That's the only grammar. And in case of today has plus third form, and passive voice has been third form. What you can understand is that passive voice third form would always be there. Was third form, has been third form. See, he has been found with, he was found with. Past was were third form, present has been third form. Passive. Active, patient complained of, active in the past. Present has plus third form, active, because patient has visited by himself. That's it. That's it. Please listen to this video 2 times, 3 times, copy paste it, and trust me, this small video of just like 30 minutes in totality will change your writing forever in a positive way. And that is how simple it is to take B in OET with this simple phenomena. If you want to copy paste it, more than welcome. More than welcome. If you want to make little amendments or changes to it, more than welcome. But do not do any grammatical mistake. Don't make any line complicated. Don't use furthermore, moreover, never in OET. Don't use so means after full stop. Small connectors like this we will talk later anyhow will confuse you. So this is how simple OET is. Just try to find the purpose, write the right purpose, do not make grammar mistake, you will get 350, not 300, 350. No grammar mistake, purpose is clear, 350 is done. That's it. Any line that you do not understand, please do not write it. Do not write any line you do not understand. One line is not going to fail you. One line is not going to get your marks deducted. But if you write a wrong grammar, then marks will be deducted because you are giving a written evidence that you do not know grammar. So rather than doing wrong grammar, it's better to avoid the line which you do not know. The only concept of OET writing is leave it if you do not understand it. Don't write it, leave it. And if the line is too big, make it simple, make it small. So please follow this strategy and again make your OET writing damn easy. This is Dr. Bhupesh from Dr. BKM Institutes. Again, our contact number is +917696734256. And please subscribe our channel if you have not. Thank you.